right. I mentioned on Friday that we are going to be starting a new chapter today. So this chapter is chapter 4 in the DHO textbook. It is covering the professional qualities of a healthcare worker. So personal and then also professional qualities. I've talked, I think, briefly with you guys about this at the beginning of the school year. I asked you, what are some things that you think are most important for a healthcare professional to possess? So we're just going to kind of go into that. A lot of this stuff, though, too, carries over to any profession. So even if you don't plan on working in a medical profession, um, this too hopefully can help you for just any job down the road. All right, so like I said, we did talk briefly about it, but what are some qualities that are actually needed in order to just be professional? And then what are those qualities that are needed to be professional as a healthcare worker? So being a healthcare worker is definitely a specialized field. You have to be a certain type of person to enjoy what you're doing. It's fast paced. You have someone's life at your hands, which a lot of people enjoy, giving back to others. And also knowing that they're actually making a difference in someone's life. That's a big reason why I got into healthcare. But yeah, it is fast paced. You have to make sure that you're making, quality decisions relatively quickly, making sure that you look professional because your appearance is huge in healthcare, being sanitary, hygienic, that sort of thing. All right, so I would say this is probably one of the most important things in general when it comes to, I would say, life, but also just a job. So your attitude is huge. I even think this transfers to the classroom as well. Your attitude in a classroom setting can make or break, your teacher's day, your day, that sort of thing. Same thing goes to show if you are working in a hospital setting, a clinic. For me, as an athletic trainer out of school, my attitude matters. How I carry myself, my outlook, that sort of thing can make someone's day either bright or also makes their day worse. And so your biggest thing is just trying to be positive. You're always showing that you care about your patients. And this is the same thing too, like I said, in any job. Your attitude can make or break your day, someone else's day. So it's just important to not only show that verbally. So if somebody is asking you something, you're responding with a positive tone. Tone is huge. You can say something where the words are positive or sound are supposed to be positive, but if your tone is not positive, then that can also affect it. And then also your nonverbal. So we'll talk about this a little bit more, but you can say to someone, I'm having a great day. But if you're non-verbally showing that you're like irritated, maybe you're rolling your eyes or something like that, that too can also convey that you're actually not having a great day. So just making sure that you're showing, you're showing to work positive. You're trying to portray that to your patients. I will say this several times throughout the school year, but if you work in healthcare, you're potentially dealing with someone on the worst day of their life. So you want to show that things are going to be okay. You're not going to make them more anxious. You're going to show that you care about them. They're not just a number. You're going to show that you're compassionate, that you're dedicated to your job, that you're competent, and you're just always trying to do your best. So mistakes are going to happen. I make mistakes still as an athletic trainer. I've only been certified for this is going to be my 6th year. I make mistakes as a teacher, but I always try to show that I'm doing my best. And if you try to show that you're doing your best, then that's really what matters. Obviously, if you're in a medical setting and you make a mistake, could be a bad thing. You could potentially kill your patient, which we obviously don't want to do. But mistakes do happen, and just making sure that if you're trying or you're working on whatever mistakes that you might possibly make. All right, reliability is also important. Reliability, again, with any profession matters. You want to make sure that your boss knows that they can depend on you. If you're working in a healthcare setting, your coworkers want to know that they can depend on you. Your patients want to know that they can depend on you. So you're making sure that you're there on time, you're doing your job well, and you're helping others out. So my brother, I think I've mentioned, is an ICU, registered nurse in ICU. And so he often deals with physicians. There are doctors out there that think that there are things that are below them. So, like, maybe they won't help with cleaning up a room. And I'm not trying to talk poorly on physicians because definitely not trying to talk, but this is just an example that my brother has shown to me. But there are physicians out there that he has worked with who will not do certain things because they think they are above that. And if you talk to anyone who is a registered nurse, they often say that they are working the whole entire time on their job. They don't often get like bathroom breaks or time to eat. And so if the physician, in this case that my brother was referring to, actually offered to help out, if they were able to, then maybe that nurse would be able to go on their break. Maybe they would be able to, eat food or go to the restroom. So it's just important to be a team player. You want to help out. Nothing should ever be below you. I have students who assist me in athletic training. Some of the stuff that they do are little things like, filling up a cooler full of water or making ice bags, things like that, because they obviously can't do injury evaluations, but I'm never going to not also do that myself. So nothing should ever be above you. You should always be helping everyone out when you can. This should say punctuality. So yeah, just being on time is super important with any job, but especially in the healthcare setting. They will fire you if you are not on time. That is why I'm pretty strict with you being on time in my class, even on the Zoom calls. But especially when we get back into the classroom, you'll realize this once we're interacting face to face. But I do mark students tardy. And a big reason is, you have the option to, if you have first period with me, to set your alarm a little bit earlier, maybe set multiple alarms so that whole alarm excuse is an excuse. So just making sure you're showing up to places on time. People depend on you. Making sure that you arrive slightly early. So like for me, if I'm normally teaching in a classroom, I am showing up to my room. I'm trying to get there well before school starts. If I'm just doing athletic training for the day, if we have a game, I'm trying to get there before I tell, the coaches and the athletes, because if they need treatment, things like that, I want to be prepared, set up for that. So just making sure you're on time or slightly early. I've even been told by mentors above me that if you're early, you're on time, and if you're on time, you're late. So if you keep that like mentality in your head, that can help you. But time gives you a chance to prepare. Nobody wants to be frazzled. And again, people are relying on you. All right, so accountability is another big one. This is one that I think I'll talk about it with healthcare, but I'll talk about it now with distance learning. You need to hold yourself accountable. There is some expectation on your end to show up to class on time, do your work, that sort of thing. So that's just you as a student. But if you're working in a job, you're getting paid for this. So they can easily find someone to replace you. So just making sure that, if you make the mistake of showing up late to your shift, you're communicating that with your higher up. You're aware that you being late is going to potentially have some consequences. So maybe they will write you up. It's important to just admit your mistakes. If you admit that you made a mistake, it's going to look so much better than you just trying to deflect or saying that, it's not my fault, it's so and so's fault. But in reality, you need to show that, you're in control of your life. There's certain things that obviously you're not in control of, but making sure that the things that you are in control of, you're holding yourself accountable for them. And then if you do make those mistakes, you're making sure that you're trying to correct them. You also want to make sure this should say conscientiousness. So this is one word. Conscientiousness is just good enough is not enough. You want to make sure that you're going above and beyond. So if you're working, again, in a medical setting, you are working with other people. And so you want to make sure that if they need help, you're offering that help. If your patient is asking for something, you are providing it for them. If they don't understand what you're talking about, you're explaining things to them clearly. And then if two, they are saying something to you, or maybe a coworker is saying something to you, you're asking for that clarification so that you know that what they're talking about is what they're talking about, and you're not going to make a mistake. And then if you do need help, it's important to just seek it when needed. So like for me, if I am struggling as an athletic trainer, can't figure something out, I might ask, one of my fellow athletic trainers, have you dealt with someone with this sort of condition? Do you know how to treat it? That sort of thing. So again, just being aware of your limitations. If I don't understand something, or if I have a kid that has, let's say, a head injury and I'm not sure if they have a concussion or not, then I'm going to refer to a physician so that they can make that decision. Because again, you don't want to be liable for something potentially bad happening, and you also don't want to harm your patient. Obviously, being courteous and respectful is huge. This is just something that's important in I think it's rule number 1 for my classroom. But yeah, you want to be polite to your patients. I'm sure some of you may have had negative experiences with healthcare workers or just people who work in general. Um, and that can affect you. I mean, again, you're dealing with someone potentially on the worst day of their life. So you want to be polite with the people. You want to, let them know what you're going to do. If they don't feel comfortable with, exposing some certain body part because you need to, let's say, take blood pressure and they have to roll up their sleeve, that sort of thing, you're always saying, do you mind if I do this? So I work with minors as an athletic trainer. And there are times where I don't, touch people in the private regions or anything like that. But there might be a time where they might need to take off their shirt. And if it's a male taking off their shirt, because I need to see that whatever they're having, maybe a shoulder injury, and I can't see it unless their shirt is taken off. So just explaining to them, do you mind if I take off, or you take off your t-shirt? Do you mind if I touch you? Again, never inappropriate, but you're always wanting to explain what is happening, what you're about to do. And if that kid tells me that they don't want me to touch them or they don't want to take off their shirt, then I have to be respectful of that. So again, you're just always being polite, courteous, saying please, thank you. All of those things are important, not just for work, but just in life in general. And I will say this too. Um, People will do more for you if you are nice to them as well than if you are rude to them. So that even goes with the patients. So, like, if you have a patient that's rude, you might not go above and beyond for them. You'll still obviously do what you need to do to make sure that they're treated correctly, but you might not do that extra step. You might not give them that extra pillow if you're in a hospital setting or take that extra time on them. Um, that sort of thing. So just making sure, just being polite as a patient, being polite as a healthcare worker is super important. Being polite as a human is super important too. This should say cooperativeness. So already talked about this, but you're often going to be working as a part of a team. So just making sure that you're offering help. Nothing should ever be below you. Like I mentioned with my brother's experience with the doctor, that doctor could easily just step in and say, hey, I have time, I can do that, I can assist you with that, instead of making it all of the nurses' jobs, the certified nursing assistant's job, that sort of thing. So just work as a team. If somebody seems to be struggling, you need to help out. Honesty is huge in healthcare. So for me, I am not typically dealing with people on the worst day of their life. I don't usually deal with, life or death situations. It could possibly happen. But I do have, moments in my job as an athletic trainer where a kid might tear their ACL. So your ACL is a super important ligament in your knee. It stabilizes it. And as an athlete, if you tear that ligament, you have instability in your knee. So that can make things like walking, bending, running, all of that sort of stuff that you need for a sport to be very difficult, and it often causes a lot of pain. So most athletes know that if you tear your ACL, it can be a long road to recovery. It could potentially cause them to shorten their career as an athlete. So it's something that if I ever have a kid that tears their ACL, I try to approach it with caution, but I also approach it with telling them the truth. So I usually will say something along the lines of, hey, I just did, my orthopedic evaluation, and it appears that you might have possibly torn your ACL. And it's really hard because oftentimes the athlete will then start crying or look really sad because they obviously know how big of an issue that is. But it's important to tell the truth. I can't just say, oh, it's fine, because in reality, it's probably not fine. And again, this isn't life or death, but for an athlete, their identity is often in their sport. So just making sure that, hey, this is what probably is going to happen. You're going to get referred to a doctor, and I'm going to let you know that there are these sorts of things if it comes back that you do have it torn, and these sorts of things that we need to do if it's not. So it's just important to be, honest. You want to also, though, be caring too. So it's not like I'm going and saying, hey, you tore your ACL, and like that's it. No, I'm going to say, hey, I think you tore your ACL. We're going to refer you to a doctor. And depending on the outcome or whatever it is that they say, then we're going to treat it as it is. I don't want you to freak out right now because we don't know yet. And even if it is torn, um, it's not always the end of your career type of thing. And it's just also important to just have integrity. So making sure that personally, you're not lying about things, you're not making up excuses for yourself. And then also just making sure that you're, being professional. And if you don't know what integrity is, I always say integrity is who you are when no one's looking. So if you know that you can get away with cheating, you might have low integrity. If you know that no one's going to catch you, you know, not doing a certain task at work, and you just choose to not do it, that's low integrity. So integrity, high integrity, is that you're going to continue to do that stuff even though you know you're not going to get caught. You're going to still want to do the right thing, and that should be something that's personal and professional. Empathy is also huge in healthcare. So we've talked about this, I think, at the beginning of the school year, but empathy is actually placing yourself in someone else's shoes. So you can have sympathy for someone, which means you can kind of relate to them, maybe have a little bit of sadness, like you feel sorry for the person. But empathy is you can actually, imagine what it might be like to be that person. So again, if I'm dealing with, an athlete and they tear their ACL, I'm going to try to be empathetic because I've never torn my ACL. I did grow up being relatively active and I'm still active today. And I know that if I tore my ACL today, I would be devastated because I do like to run and, work out, that sort of thing. So it's just important to do that. Again, if you plan on working in a hospital setting, you're dealing with more life or death situations. So you're wanting to be empathetic. If someone gets diagnosed with cancer, you're going to obviously try to show that you have not only compassion for them, but you can kind of imagine what it might be like if you were to be, or a family member was to be given that same diagnosis. Appearance is also super important. So first impressions are, they're based relatively quickly, and a lot of times they're based on appearance, which sounds horrible, but it's the truth. If I showed up to work looking disheveled, I don't know, just wrinkly clothes, things like that, on the first day of teaching, you probably would be like, what is she doing as a teacher? That's the same thing as you working in a healthcare setting. So your appearance shows that you are confident. It shows that you have, positive self-esteem. You care about yourself, your hygiene. So if you do see people that are working in healthcare settings, people with longer hair will typically have it pulled back out of their face. Makeup's usually going to be minimal. Depending on where you're working, they're probably not going to let you have like piercings, a lot of tattoos, things like that. I have a tattoo that's on my upper arm, and it's kind of hidden because it's on the inside. But I know that anytime I start a new job, I have to be aware that they could potentially tell me I need to cover it up. And so normally when I'm teaching, I'm wearing like a cardigan or a sweater if I'm in the classroom because it's usually relatively cold. Some of you might have noticed it already by now with this distance teaching because I don't have air conditioning in my apartment, so it's super hot. But I do have a tattoo on my upper arm, and usually I hide it. I try to hide it. And so it's just important. Tattoos I am not against, obviously, because I have one. But you just need to be aware that some people can perceive tattoos, piercings, things like that, crazy hair colors as you being unprofessional. So just being aware of if you want to get a tattoo, where you're placing it, that sort of thing. So I always tell people, if you plan on working in a healthcare setting, probably not a good idea to get tattoos on your hands, on your neck, on your face. You want those things to be easily covered. So yeah, going along with appearance, you want to make sure that you have good personal hygiene. So, you're bathing, that sort of thing. Your hair should be pulled back if it's longer, out of your face. Teeth should obviously be brushed. Clothing should be, again, clean, free of wrinkles, should be neat, should look just professional. So in a healthcare setting, you're going to most likely be wearing scrubs or something along those lines. So yeah, just making sure you're wearing what is appropriate. For me in athletic training, when I'm out working like a game, I have to wear like a polo t-shirt. You're not going to see me in like ripped jeans, things like that. A couple other things. So yes, all of these qualities are important, but your physical health can also affect those qualities, if that makes sense. So it's important just to stay healthy. So making sure that you're getting a good night's rest if you are working in a healthcare setting, because the days are long. You're, potentially dealing with people in the worst days of their life. So you want to be alert, making sure that the food that you're eating is, nutritious, well balanced. I tell my students when we go over nutrition, I probably live like an 80-20% lifestyle. If you don't know what that means, it's like 80% of the time I eat relatively healthy, and then 20% of the time I don't. And so I have some food sensitivities. And so when I'm teaching during the work week, that's like my time to pretty much eat healthy because I know that it makes me feel good. I don't feel tired when I eat healthy. Whereas on the weekends, then maybe I'll splurge a little bit. I'll have dairy. Not that I'm saying dairy's bad, but again, I have food sensitivities. So for me, dairy makes me feel sick. But I do love cheese. So I just know that if I'm, not working, then maybe I can splurge a little bit. But when I am working, I'm probably not going to do that just because I know how it makes me feel. And then that's going to affect my quality as an employee. Making sure you're exercising. For me, exercise is very good for my mental health. If I have a stressful day at work, exercise helps me with that. That way, the next day when I go back, I'm not still carrying the same amount of stress as before. Making sure that you're staying away from addictive substances, so like alcohol, prescription drugs, things like that. Those often people use to they use it to cope. So if they have a stressful day, they might turn to alcohol, things like that. So just making sure you're staying away from that because, again, that can affect you the next day as an employee. And then just making sure you're taking care of your health. So for you guys, you're young, your body's probably in pretty decent shape at your age, but as you get older, it's important to have physical exams to just get checked up. It's kind of like a car needing, a normal checkup service. Emotional health is super important. So I talk about this all the time. But you want to make sure you have a balance between your work life and your personal life. My first year teaching, I taught only 3 periods at Sunny Hills, but then I also was a full-time athletic trainer at another high school, which was about 45 minutes away. So that meant that I was waking up super early, working, and then going over there, and then working until like 8, 9 o'clock at night, and then doing that all over again. So my first year of teaching, one was just really stressful. And I just didn't take care of my emotional health. I like never worked out, which again, working out for me is my stress relief. I know it's not everyone's. So I never worked out. I wasn't getting enough sleep. Um, I was eating poorly because I just didn't have time to, cook food, things like that. So it's just super important to be aware of having that balance. Your life should not revolve around work. Work is super important, but your personal, mental, emotional health matters too. So just making sure that you're not bottling things up, doing things that are healthy, developing those healthy coping mechanisms. So again, you're not turning to addictive substances when you've had a stressful day. You're maybe exercising or meditating or maybe taking like a nice warm bath. I don't know, whatever it is that you're into, binge watching some show on Netflix, something that's just going to make you feel good. And then these are just some stress reducing techniques. So I apologize why these slides are all funky, but you want to make sure that you're living a healthy lifestyle, taking breaks when you need to. So again, if you work in healthcare, I have mentioned it is a fast paced profession. So if you do need to take, a day off, put your time off, put in that time to take off. If you want to relax, maybe taking a warm bath. Maybe it's you want to listen to quiet, soothing music. I know for me, if I want to release some stress, I'm probably not going to be listening to some quiet music. It might be, something like hip hop or whatever it is that you're into. Um, Meditation, which is what this is talking about. So closing your eyes, deep breaths, relaxing. And then another thing is just making sure you're seeking support from others. So working in healthcare can be very rewarding, but oftentimes too it can be a lot. And you're doing so much to help your patients that sometimes you forget about taking care of yourself. So just making sure that you're, talking to others who maybe have a similar experience as you or profession as you so that you're not bottling everything up. Working in a healthcare field, again, like I said, is rewarding, but it can also have a high burnout rate. So again, you're constantly taking care of others, you forget about yourself, and then you just get emotionally, physically exhausted. And then that's where people quit their jobs. So you just never want to get to that point. So just making sure that you're seeking support if you need it. And then just in summary, Stress is always going to happen. I mean, I know a lot of you are probably stressed out right now with distance learning, the whole setup, maybe being stuck at home is really stressful. I know it is for me at times. But stress is something that, you can't avoid. You need to figure out, what is it, the cause of it? If it's that maybe you have too much schoolwork, are you really managing your time? If it is that, in your job, something's stressing you out, maybe addressing whatever it is that's stressing you out, learning how to, positively cope with it, how to reduce the stress, things that make you happy. Again, this presentation is more generalized. I think it can be helpful for you as a student, helpful for you as a healthcare worker, helpful for you as any employee down the road. But yeah, emotional health, mental health, all of that stuff I will talk about throughout the year. I think it's super important because, yeah, you're not going to be a good employee if you don't take care of yourself. So, anyways, that is it for the presentation today. Make sure that you have your notes scanned. Please do not take a picture of your notes unless you have talked to me otherwise about why you're taking pictures of them. I need them scanned so I can see them clearly. And then tomorrow we will talk about this, and I hope you have a good rest of your day. Bye.